1879. European hospitals are killing 85 out of every 100 women who need a cesarean section. Surgeons are operating in blood-soaked coats. No antiseptic, no understanding of infection. Mothers are begging doctors not to perform the procedure. It's considered a death sentence. That same year, in the Bunyoro Kingdom of East Africa, a surgeon performs the same operation with anesthesia, with antiseptic protocol, with precision that won't be matched in Europe for another 60 years. Both mother and child survive. A British doctor watches the entire thing. He publishes what he saw, and Europe calls him a liar. So let me show you exactly what he witnessed and why they had to bury it. London, Paris, Berlin, 1879. Women are dying on operating tables across Europe. Cesarean sections have an 85% mortality rate. 85%. Let that number settle. That means if you're a woman in labor and something goes wrong, and a European doctor says you need this procedure, you're almost certainly going to die. Why? Because European surgeons don't understand infection. They operate in the same coats day after day, crusted with dried blood from previous patients. They think the stains prove experience. They're proud of them. They reuse instruments without cleaning them. They have no concept of antiseptic technique, even though Joseph Lister published his findings on germ theory 12 years earlier. Most surgeons reject it as nonsense. They call it a fad, unnecessary theater. And when they do use anesthesia, ether, chloroform, they're guessing at dosages. Overdoses are common. Women die from the anesthesia before the surgeon even makes the first cut. This is modern medicine in 1879. That this is the height of European medical achievement. And this is what Europe is preparing to bring to Africa as civilization. But here's what they found when they got there. Robert Felkin, British medical missionary, trained at Edinburgh University, one of the best medical schools in Europe. He arrives in the Bunyoro Kingdom in 1879, present-day Uganda. He's there to bring modern medicine to primitive people. That's what he was told. That's what he believed. That's what every European doctor believed. What he expected. Witch doctors, superstition, herbs and rituals with no scientific basis. Maybe some basic bone setting, but nothing that could be called surgery. What he found? A medical system he didn't have the training to fully understand. Within weeks of arriving, he's told a cesarean section is about to be performed. He asks to observe. They allow it. And what he sees over the next hour will contradict everything his medical school taught him about Africa. Everything the British Empire told him about African intelligence. Everything. So let me walk you through what he saw, step by step. Because this isn't just a surgery. This is evidence of a medical tradition Europe spent the next century trying to erase. If you're already realizing how much you weren't taught, make sure you're subscribed. Because we're reconstructing history they deliberately buried. The patient is a young woman. Labor complications. The baby won't come. In London, this is a death sentence. Here's what happens next. The surgeon, his name is recorded as Muhumusa, prepares banana wine, not random alcohol, measured doses. The patient drinks. Within minutes, she's sedated but conscious enough to respond to commands. Felkin writes in his journal, the dosage appeared to be calculated based on body weight and tolerance. Think about what that means. Europe is still killing patients with chloroform overdoses because they don't know how to measure it properly. Africa is calculating anesthesia based on patient weight. In 1879, the surgeon takes an iron blade, heats it in fire until it glows red. Let that image settle for a moment. Fire sterilization. Heat killing bacteria and pathogens. In 1879, most European surgeons won't accept germ theory until the 1890s. They'll spend another decade arguing about whether invisible organisms can cause disease. And here's an African surgeon using fire to sterilize his instruments. The patient is placed on an inclined bed. Deliberate angle. Why? The blood flow control, gravity assisting drainage. This isn't improvisation. This is physics applied to surgery. Muhumusa isn't alone. 3 assistants, each with a specific role. 1 controlling hemorrhaging, 1 retracting tissue and muscle, 1 ready to receive and clear the infant's airways. Division of labor, specialized training, systematic procedure. Felkin is watching this, and his entire education is being challenged in real time, because this is not, as he was taught, primitive medicine. This is a refined surgical tradition. And then the operation begins. The cauterized blade touches skin. 1 cut, clean, controlled, through the abdominal wall. Felkin is watching the depth. He's a trained surgeon himself. He knows how easy it is to cut too deep, to pierce the uterus, to cause catastrophic bleeding. He's seen it happen in Edinburgh. He's seen women die from that single mistake. Muhumusa stops at the exact layer. No hesitation, no trial and error, no uncertainty. He's done this before. 2nd incision, through the uterine wall. Again, perfect depth. The baby is visible. Here's where European surgeons panic, because once the uterus is open, you have minutes. Minutes before blood loss becomes fatal. Minutes before infection risk skyrockets. The best surgeons in London are racing against time at this point, hands shaking, assistants scrambling. Muhumusa doesn't panic. Assistant 1 applies pressure to blood vessels, manual compression, controlled bleeding. Assistant 2 retracts tissue, giving the surgeon room to work. Assistant 3 receives the infant, clears airways, stimulates breathing. The baby cries. The mother is still alive. And now comes the part that changes everything. Muhumusa takes the cauterizing iron again, still red hot. He touches it to the edges of the blood vessels in the uterine wall. Cauterization, sealing the wounds with heat, preventing hemorrhage, and killing bacteria in the process. Felkin writes, this is a direct quote from his 1884 report, the use of fire appeared to serve a dual purpose, hemostasis and what I can only describe as a preventive measure against mortification. Mortification, Victorian medical term for infection. Read that again. Felkin is watching an African surgeon use antiseptic technique, and he doesn't have the conceptual framework to fully name what he's seeing, because Europe doesn't have this yet. Lister published his antiseptic methods in 1867. It's now 1879, 12 years later, and most European hospitals still reject it. But here, in what Europeans are calling darkest Africa, a surgeon is preventing infection as standard procedure. The uterus is stitched closed, not with catgut or silk like European surgeons use, with organic fiber that will dissolve over time. Early absorbable sutures. Europe won't develop these until the 1930s. Let me repeat that. Europe won't develop absorbable sutures until the 1930s. That's 50 years after this moment. The abdominal wall is closed. More stitching, precise spacing, even tension. And then, this is the detail that should make you stop. Fresh banana leaves are applied to the wound. Felkin thinks it's symbolic, ritualistic, maybe spiritual. It's not. Banana leaves have natural antimicrobial properties. They create a sterile barrier. They're slightly astringent. They help the wound stay clean and dry. This is applied pharmacology. This is botanical medicine integrated into surgical practice. The operation took 20 minutes. In Europe, the same procedure takes hours. If the patient survives the first hour, it's considered a miracle. Here, it's routine. Let that sink in. An African surgeon in 1879 is performing a procedure with antiseptic protocol, absorbable sutures, calculated anesthesia, and herbal antimicrobials. while European medical schools are still teaching that Africans are biologically inferior and incapable of complex thought, while missionaries are writing home about bringing light to the dark continent, while empires are justifying colonization as a civilizing mission. If this is destroying everything you were taught about African history, subscribe now. Because this is just the beginning. Felkin stays to observe the recovery. He needs to see if this was real, if it will hold. Day 1, the wound is inspected, cleaned, fresh banana leaves applied. A herbal preparation is administered. Felkin doesn't recognize the plants, but he notes in his journal the patient's pain appeared managed and no fever developed. Pain management, infection prevention. Day 2, the patient is sitting up, eating, nursing the infant. In a London hospital, women who survive cesarean sections are bedridden for weeks. Infections are expected. Fever is normal. Death in the days following surgery is common. Here, the patient is recovering faster than anything Felkin has seen in a European hospital. Day 3, Felkin performs his own examination with permission. No infection, no excessive bleeding. The wound closing properly. He writes, and this is another direct quote, "I have attended numerous surgical procedures in Edinburgh's finest hospitals, and I can say without reservation that I have never witnessed a more cleanly or systematically performed operation. Both mother and child survive. In Europe, this outcome is considered miraculous. Surgeons write papers about their rare successes. In Bunyoro, it's expected. Think about what that means. This wasn't an experimental procedure. This wasn't a lucky accident. This wasn't a one-time innovation by a singular genius. This was a refined technique passed down, practiced, perfected over generations. Muhumusa knew exactly what to do because he was trained in a medical tradition, a tradition that had been operating in East Africa for longer than anyone knows. A tradition with systematic knowledge, specialized training, and empirical methods. And when Felkin published his findings, Europe tried to pretend it never happened. 1884, 5 years after witnessing the operation. Felkin publishes his account in the Edinburgh Medical Journal, the title, Notes on Labor in Central Africa. He describes everything, the anesthesia, the cauterization, the antiseptic protocol, the recovery, the survival. He includes details, measurements, medical terminology. He writes it the way he'd write about any surgical observation in Europe. Clinical, precise, professional. He expects this to be studied. He expects European surgeons to take note, maybe even learn from it. Maybe even consider that African medical knowledge deserves serious examination. That's not what happens. The responses from the European medical establishment clearly exaggerated. The patient likely wasn't truly pregnant, perhaps a tumor or false pregnancy. Even if true, this represents a primitive people stumbling upon a technique by accident, not systematic knowledge. One reviewer writes, "We must be cautious about attributing to African practitioners any intentional scientific method." Another dismisses it entirely. Interesting anecdote, but hardly evidence of medical sophistication. Translation: even if we saw it, we can't admit it was real. Why? Because in 1884, the scramble for Africa is accelerating. The Berlin Conference is happening. European powers are carving up the continent like a dinner table, drawing borders, claiming territories. And the entire justification for colonization rests on one premise. Africans are inferior and need European civilization. If Africans have advanced medical knowledge, if Africans are performing surgery better than Europeans, if Africans have systematic training, scientific traditions, and empirical methods, then what exactly is Europe bringing them? What justifies the conquest? What justifies the theft of land, resources, sovereignty? The answer: nothing. Nothing except violence. So Felkin's account gets published once, in one medical journal, and then ignored. never referenced in surgical textbooks, never included in medical school curricula, never studied, never replicated, never investigated further, buried, not because it was false, because it was true, and the truth was too dangerous. Here's what happened next. Colonial authorities arrive in Bunyoro. British administrators, Christian missionaries, colonial governors. They outlaw witchcraft. Sounds reasonable, right? Who would defend witchcraft? But here's what gets classified as witchcraft: traditional medical practices. Surgeons like Muhumusa are forbidden to operate. Herbal medicine is banned. Medical training systems, the apprenticeships, the oral traditions, the passed down knowledge that took generations to develop, are dismantled. Why? Because colonial medicine must be seen as superior. Because if Africans can heal themselves, they don't need Europeans. And the entire structure of colonization, the moral justification, the economic extraction, the political control collapses. So they destroy the knowledge. They criminalize the practitioners. They burn the herbs. They outlaw the training. And then they rewrite the textbooks. By 1920, the narrative is set. Europe brought modern medicine to Africa. Before colonization, Africans had no surgical knowledge. Traditional African medicine was superstition and ritual, not science. This is what's taught in schools. In Africa, in Europe, in America, everywhere. Generations of African children grow up learning this. They're taught their ancestors knew nothing. They're taught their own medical traditions were primitive, backwards, dangerous. They're taught to be ashamed of their history, to reject their heritage, to see European knowledge as the only real knowledge. And the evidence? The evidence that contradicts all of this? Locked in a Victorian medical journal that no one reads, buried in colonial archives, erased from memory. But here's what makes it even worse. While they were erasing this knowledge, European hospitals still couldn't perform the procedure safely. Let me give you the timeline, because this is where the lie becomes undeniable. 1879, African surgeon performs successful cesarean with antiseptic protocol. Both mother and child survive. Recovery in 3 days. 1880 to 1900, European hospitals. C-section mortality rate remains between 60 and 85%. 2 decades, no improvement. 1910, European C-section mortality rate drops to 50%. Still worse than what Felkin observed in Africa 31 years earlier. 1920, antiseptic technique finally becomes standard in European hospitals. 41 years after Muhumusa was already doing it. 1930s, absorbable sutures developed in European medicine. 50+ years after they were used in Bunyoro. 1940s. European hospitals finally achieve C-section survival rates comparable to what Felkin witnessed in 1879. 60+ years later. Read that again. It took Europe more than half a century to match what an African surgeon was already doing in 1879. 6 decades. And during that entire time, while European women were dying on operating tables, the story of the Bunyoro surgeon was buried, hidden, dismissed, erased. Because if people knew the truth, they'd ask the question that destroys everything. What else were they hiding? This isn't just about one surgery. This isn't just about one doctor or one kingdom or one operation in 1879. This is about the systematic erasure of African intellectual achievement. When you were taught that Africa had no history, you were lied to. When you were taught that Europe brought civilization to Africa, you were lied to. When you learned that Africans contributed nothing to science or medicine, you were lied to. The evidence was always there. Felkin's account exists. It's in the Edinburgh Medical Journal, Volume 29, published in 1884. You can find it. Archaeological records exist, surgical tools, medical instruments, Evidence of trepanation, bone setting, herbal pharmacology across the continent. Oral histories exist, traditions passed down, stories of healers, surgeons, midwives who knew things European doctors didn't. European travelers' journals exist, dozens of accounts like Felkin's, observations that contradicted the official narrative. But it was deliberately excluded from the curriculum, deliberately left out of textbooks, deliberately buried. Why does this matter now? Because every African child who grows up thinking their ancestors were primitive, that's a wound, a psychological wound that affects how they see themselves, their potential, their worth. Every student who learns that real medicine came from Europe, that's a theft of heritage, of pride, of historical truth. Every time African medical knowledge is dismissed as alternative or traditional instead of scientific, that's colonial language still operating, still doing its work, still maintaining the hierarchy. The reclamation starts with stories like this, with evidence like Felkin's report, with the recognition that Africa wasn't waiting to be saved. Africa was already healing itself. Africa had knowledge systems, training methods, empirical traditions, and they had to destroy that truth to justify what they did. In 1879, an African surgeon performed a cesarean section with anesthesia, antiseptic technique, and precision that European hospitals wouldn't match for another 60 years. A British doctor documented it, published it, provided evidence. The medical establishment buried it, not because it was false, because it was true. And the truth was too dangerous, because if Africa had advanced medicine, systematic knowledge, and surgical traditions, then colonization wasn't rescue. It wasn't civilization. It wasn't progress. It was theft. And they couldn't let you know that. But now you do. This is the history they don't teach. But it's the history that needs to be told. If this changed how you see Africa's past, subscribe to this channel, because every week we're bringing back what they tried to erase. Drop a comment. What other African achievements do you think were deliberately buried? This is Ancient Africa Untold, and we're just getting started.